Hi there, Matt here at Clearwater Physical Therapy. Just wanted to chat with you guys today a little bit about what to expect when you're coming in for your treatment for low back pain. So initially what we'll do is spend some time asking you questions specifically about your back pain, what it feels like, time of day, does it feel worse in the night versus the morning, just questions that's specific to you so we can understand more about what you're going through. And then look at some options on how to assess it when you first come in versus a few treatments down the line, so we can show you that you're making an improvement and that you can understand that what you're doing is working. Typically what we would do is just provide you with a lot of education, because knowledge is power. We want to make sure that you understand what is happening and how we can help you with that. So we might start with some exercises on the bed, maybe doing some hands-on stuff just to get things moving, because we know that movement always beats pain to the brain. Common misconception is that if it hurts, we don't want to move. But research does show that if we get things moving, you'll start to feel a little bit better as we progress, because movement always beats pain to the brain. Once we start feeling a little bit more comfortable, we can progress you into the gym so we can start doing more functional things that are specific to you, so you can get back to doing what you usually do throughout the day, hopefully in a pain-free range of motion, and then also work on strengthening different areas to help you get back to doing things that maybe you'd like to do, and focus on some of those goals.